Hello, welcome everyone. I'm Dr. Goswami here in Newport Beach, California, and my co-host Paul Newhouse is in Houston, Texas, surviving the strong rains and the winds there. So we thought about putting this talk together because a lot of word about stem cells is out there, and I think there's a lot to learn. There's a lot still, we don't know, but there's also a lot of information that I think people need to be aware of, especially when considering this treatment. So we'll take it from here. I'll give the first portion of the talk, and then Paul will join us later. So I kind of titled this Stem Cell Facts versus Fiction because that's what really is happening out there in terms of, what is really stem cells. I mean, I tell people, especially before the social distancing came into place, that you could be enjoying your drink at a bar and you turn towards your right, and you've got a guy who is raving about how stem cell treatments change his life, help him out. And then you can turn towards the left and you would have a person saying, well, it's all bogus. I tried stem cell therapy. It didn't do anything for me. It was a wastage of money. So what really is where the science is very, very important to know. What is a stem cell? I'm sure a lot of you are aware of it, but just in terms of, that's where we all start our journey. It's the cell that happens once we are conceived. And then as we develop, that stem cell differentiates into different cells and different organs are formed. However, it has one very unique property, which is that it's capable of self-replicating. So our stem cells are constantly replicating themselves, and then in turn, they produce other cells. So where are stem cells? Everywhere, from the time we are a single cell embryonic stage to all the stages up to the adult. Our body is full of our own stem cells. What does a stem cell do? And I hate to date myself, but this was the information in the first textbook of medicine once I entered medical school over almost 25 years ago. And they are capable of regenerating and replacing dead cells. They slow down the breakdown process in disease and injury. They improve blood flow. They're capable of forming tiny new blood vessels. They release valuable growth factors and enzymes. They are anti-inflammatory in action. And they're powerful immune modulators, especially when our body is trying to fight our own cells. The picture you see is an actual electron micrograph of a human stem cell. I tell people if we were to design a super pill that could take care of all of our problems or majority of our problems, these would be the properties we would be looking for in that pill. And that pill exists in our own body. So how does this apply to disease and injury? What has happened is that we've been looking at disease and injury as this is a liver disease. This is a disease of the kidney. This is affecting the heart. So we look at organs as structures, but what are these structures made up of? Cells. So it's very, very important to start understanding that the damage or disease or inflammation or injury happens at a cell level. And when that happens, that's what leads to symptoms. And that's what leads us to seek medical advice or treatments. When that injury is reversible or of a low grade, we rest and recover. In fact, that's how we are able to survive on a daily basis. Our body is constantly facing different kinds of insults. We work out, we get sore. We have minor injuries, sprains, we rest and we recover. But when that injury becomes persistent and progressive, that's when we start experiencing symptoms. Unfortunately, the medical advice usually comes in the form of medications or surgery, both of which are honest in their intentions, but do come with side effects and sometimes more harm than good can happen. And that is where we see the role of stem cell therapy as things evolve coming in, because we're finally starting to look at disease and injury at a cell level. What is happening at the cell? How can we repair and heal the cell? Coming back to ground realities, currently, if somebody's looking at stem cell treatment, what are the sources of stem cells that are available? Obviously, there's always foreign cells. Pure embryonic stem cell, which was supposed to be the holy grail, is obviously banned for obvious reasons because it involves sacrifice of human life. And we don't even think that that is necessarily the answer. There are certain other stem cells sold in the market, mostly coming from pregnant women or newborn babies where there's no harm to human life. But as we taught, our own body itself is a tremendous source of stem cells. Yes, there is a minor harvesting procedure that's needed, but stem cells can be harvested. And two of the commonest sites that we've gone after are bone marrow and fat. And primarily the reason being is because we have been collecting bone marrow and fat for many years. So the techniques of collection are very, very refined. And we know that collecting bone marrow or fat does not leave any footprint or harm on the body. But let's take, what do we really mean by fat stem cell? It's actually fat-derived stem cell. Fat is merely serving as a source of getting stem cells. And this is a major confusion because I walked into clinics where literally fat is being harvested, squished around in 2 syringes and injected into the joint and is being sold as stem cell therapy. 90% of the fat is oil. It's fat cells. The reason we're going after fat is because it's an easily collectible source. 20 years of practicing medicine, no patient has ever questioned me how much fat I'm going to remove from them. So if I can collect as much fat, break it down and filter out the stem cells, that is serving as a source. But fat injection is not what you're looking for. Fat is merely serving as a source. I tell people tomorrow, if we have a device that I can scrape somebody's skin and get the millions of stem cells we're looking for, that'll be a lot easier process. And I'd rather do that. So it's very, very important to understand that you're not going for fat injection. If somebody is injecting fat into your joints, that is not stem cell therapy. Bone marrow is another excellent source, and we've been collecting bone marrow for many years. In fact, bone marrow transplant was the first attempt at stem cell therapy, where you have blood cancer and you're replacing the bone marrow with a fresh, healthy bone marrow so that fresh cells can be made. The only knock on bone marrow generally is that it's perceived to be very painful, and it doesn't have to be. If you have a properly skilled, trained physician who knows what he's doing, bone marrows can be collected fairly easily. They're not as strong a source of stem cells as fat, but they do come with certain other growth factors and other valuable elements that can help in regeneration and repair. And then we come to foreign cells, as I mentioned, usually come from pregnant women or newborn babies. These are collected, obviously, processed in a laboratory, they're frozen, and then they're thawed, delivered to the clinics and used. The word of caution there is, obviously, it's coming from a foreign source, so we need to make sure that the foreign source was screened for infection. And as we're learning at great cost, we don't know all the infection that's out there. Also, they have to be processed in the laboratory. And even though those are immature cells or generally sold as immature cells, they still have the potential of causing a reaction or a delayed reaction. Just like, as much as somebody in your family would want to give you an organ or their cells, you cannot take those unless they have been matched. So we know very little right now about how that process would be done. They're frozen and stored and then sent over. So the viability of the cells, the number of live cells go down. So those are the things that are really concerning about foreign cells. Whereas your own cells are collected from you, you do have to undergo minor procedures. And because they're your own cells, we're generally not concerned about any reaction or rejection by your body. Minimal processing is required. And because they're fresh, the viability rate tends to be very high. And the counts are also, and as Paul will talk about, that's where Celltex has taken the lead, that not only can they multiply and make more of your own cells for as many treatments your condition might need. And then it's a no-brainer. Yes, your own stem cells come with the least risk, because when all different varieties of stem cells are compared, your own stem cells pose the least risk to you in terms of developing any new disease, cancer, tumor formation, or anything else happening. Well, we come back to where we started the talk. Why is it that some people still would call it a bogus, fad, or does not work? And I think the primary reason is the lack of standardization. The word stem cell therapy does not mean anything right now because it's not standardized. What source of cells are you getting? How many cells are you getting? How many of those cells are alive? How are they being delivered? Does it even have a role to play in your condition? And how is it going to help with the regeneration? So all of those are very pertinent and strong questions to consider before submitting yourself to stem cell therapy. Unfortunately, commercialization has always been ahead of science. So what are the stem cell facts? All stem cell treatments are not the same. All stem cells are not the same. More than one stem cell treatment may be required depending on your condition. And it's very important because these treatments, you are spending money to have these treatments done. So it's very, very important to understand how they fit in your life. Stem cells do require you take care of your body. 20 years of doing procedures, I tell my patients, being honest, I can technically do the same procedure and have two very opposite outcomes. The X factor is always your body. Diet and exercise are critically important. And that is irrespective of whether you're having stem cell treatment, surgery, or taking any medications. For them to be effective, you have to do your part and keep your body well optimized. Stem cells replace cells, they do not replace organs, at least not yet. What are the limitations? And Paul will further expand on these. The potential of stem cells, the different types of stem cells, their applications, dosage. What do we really mean by how many stem cells you're getting? What are some of the risks involved? As far as the FDA is concerned, which is the elephant in the room, no treatment is approved. We can use some fancy languages to kind of skirt around the issue, but let's be honest, the FDA does not approve these treatments currently. There are a few research protocols, but the bigger issue I see going forward in terms of jumping the regulation as well as one day hopefully having insurance on board for this treatment is that we have to change the mindset of how we view disease and injury, which has been largely a structural viewpoint, as I mentioned. Physicians look at liver disease, kidney disease, heart disease, and think from an organ standpoint. We have to start thinking from a cell point. For example, what is the FDA's current main concern? In their books, fat is defined as a tissue that cushions different organs. That's it. So they're looking at fat as a structural tissue. And it's okay if fat is being used for breast enlargement, enhancement, or being used in cosmetic procedures to fill in, use it as a filler, because they feel it still maintains the role of fat intact, that it's a cushion. Whereas they're missing the whole point that the only reason to go after fat is because it's an easily collectible, in large amount, source of stem cells. We are the first ones to agree that there is no role for fat going into a joint because fat should not be injected into a joint. But what we're talking about is taking fat, breaking it down, filtering out your stem cells, and then using those stem cells to treat different conditions. So that is extremely important. And our hope is that with more and more knowledge and science out there, that finally that shift will take place where we don't look at disease just from a structural or organ-based point of view, but from what's happening on a cell level. I'll now pass it on to Paul to continue with his part, and then hopefully we'll take some question and answers.
Thank you, Dr. G. I'll get my part of the presentation up here on screen for everyone. Just one second. And I do see a few people are raising their hands and submitting questions. That's great. Please continue to do so. As Dr. G just mentioned, we will do Q&A following the presentation, and I'll try and make my section brief because I know many of you would like to ask Dr. G questions. But thank you again, Dr. G, for allowing me to speak here alongside you, and it's my privilege to do so. I think it's important to note that there are differences between what Dr. G is doing at his clinic and what we're doing at Celltex. But the reason we make such great partners is there are synergistic effects and complementary effects between what we're doing. And Dr. G in his talk highlighted a lot of the philosophical similarities that we share in how we view, first of all, working with your own stem cells. We are a strong believer in working with your own stem cells at Celltex versus working with stem cells from a foreign source or a donor. So I'll talk a little bit about some of what we're doing at Celltex that highlights those similarities with Dr. G, and also a little bit of the differences in how kind of both of us work together in this area of stem cell therapies. So autologous stem cell therapy, that's what we're talking about. We're talking about stem cells that are coming from your own body. And another new term to introduce here is the notion of a mesenchymal stem cell, or an MSC. So this is essentially synonymous with the stem cells that Dr. G was referring to in his portion of the presentation, but just giving it that technical term, whether we're talking about MSCs from adipose or fat tissue, which is what we utilize at Celltex, or even bone marrow, which is what Dr. G uses in conjunction with adipose tissue in his office. And the key reason being is these properties. Dr. G mentioned the notion of a pill. If we could design a pill, these MSCs would, or this pill would exert the same properties as these MSCs do. And among them, their ability to reduce inflammation in the body, regulate the immune system, also known as immunomodulation, and restore and create blood flow, that angiogenesis that Dr. G mentioned. And when we work with your own stem cells, there's no ambiguity or unknown regarding the viability or the source of these stem cells, and no risk of rejection. And again, these are cells that are already within your own body. In many cases, they just need to be concentrated and perhaps injected into a specific site, or there may be a need to replicate them or increase the dose of stem cells to increase your body's natural regenerative capacity. I'll speak more about how we do that at Celltex. To physicians like Dr. G and other researchers around the world, MSCs are nothing new. There are, in fact, if you go on clinicaltrials.gov, well over 1,000 clinical trials out there utilizing specifically MSCs as the therapeutic agent, encompassing various disease categories: autoimmune, vascular, neurological, cardiovascular, and degenerative. At Celltex, we've worked very commonly with things like rheumatoid arthritis, MS, Parkinson's, osteoarthritis, other types of soft tissue injuries and injuries of the back, as well as some of the vascular conditions you see there as well. So like Dr. G said, I mean, MSCs just have really a wide variety of potential for a wide variety of maladies. So something we do a little bit differently at Celltex is we do actually bank or cryopreserve stem cells. So some of you may be familiar with that concept, but for those who aren't, we'll talk a little bit more about that. And that is essentially the process of harvesting that fat tissue, much like Dr. G talked about. We work with, at Celltex, a smaller sample of fat tissue, and then we isolate the stem cells from that tissue. But then kind of a key differentiator of our process is we expand or multiply those stem cells so that we can create what we would consider a master cell bank for present and future use. And that's what is cryopreserved or banked at our facility. And that's actual pictures of our facility there you see on screen. On that top picture in the foreground, you can see the liquid nitrogen tanks, which keep the cells cryopreserved. And then there in the back, that is what an actual stem cell bank looks like. So again, we work with adipose or fat-derived MSCs at Celltex. You may not have a condition that requires an immediate treatment with stem cells, but stem cell banking is a way that you can plan for the future. And again, with our culturing process from a single fat extraction, we're able to ensure a lifetime supply of MSCs. So again, from a single fat extraction, a lifetime supply of stem cells because of our proprietary culturing process. What are we doing by banking sooner than later? Well, you're maximizing the viability of your stem cells at their youngest possible age. That's not to say that as you get older, your stem cells are useless. It's certainly not the case. You know, our average age client at Celltex is probably somewhere in their mid-60s. And again, these are people working with their own stem cells, several in their 70s, even some in their 80s and 90s who have worked successfully using their own stem cells. But if you can bank sooner rather than later, it's advantageous to do so. If you were to bank now, in 5 years, your stem cells in the bank would then be 5 years younger than you are at that time. 10 years from now, 10 years younger than you are, and so on and so forth. So really the idea is to lock those cells in time, frozen in time, literally, at their maximum possible viability. So the stem cell banking process is actually 3 simple steps. There would be an enrollment step, which you can do through Celltex. Actually, I'm in the client services department at Celltex, so we have other coordinators to assist you with this process, whether you do it online through our website or send us the enrollment forms. We do a qualifying blood screen. Dr. G mentioned this in his part of the presentation as well, as far as screening for communicable diseases, which we do. And then the extraction procedure. Dr. G is proudly one of our partner physicians there in the Newport Beach area in California. We have other local physicians all throughout the country that can perform this extraction procedure. Again, a very amount of fat taken in our process, only about 20 cc's. And of course, with everything going on at that same appointment, there will be a COVID test as well. So really the only things that disqualify you from proceeding with the stem cell banking process would be screens for those communicable diseases, any positive tests for those you see there on screen, as well as the COVID test. All those come back negative, you're qualified to proceed with stem cell banking. So what comes after you bank your stem cells? Well, as I mentioned just a minute ago, if you don't have an immediate need, then it could be nothing. Your stem cells are just there in the bank, cryopreserved for when you need them, whether that be in 6 months, 6 years, 16 years, or longer. MSCs can be stored indefinitely for the rest of your life. And another point here, this question about what does the future hold for medicine and science and regulation? And again, one of the things where we align philosophically perfectly with Dr. G is the fact that we acknowledge that we don't have all the answers at this point. This is still very much an evolving field. And with the FDA as well, things are changing. So banking is perfectly fine with the FDA. So banking your stem cells now is a way that when things advance with medicine and science in the future, as well as regulatory, you will have your stem cells in the bank and be able to take advantage of that. And certainly FDA approval, insurance coverage, things like that are big goals for Celltex and physicians like Dr. G, so that we can make these processes more accessible and affordable to people. What about stem cell therapy? Well, we also have a clinical partner here at Celltex, and it's Galenia Hospital you see there on screen. That's actually a facility in Cancun, Mexico. Because of FDA regulations, the FDA views cultured stem cells as we do as a biological drug, and therefore we're not able to do therapy here in the US. We're kind of limited on time to go into that, but that's essentially the reason why the banking can take place here in the US, but the therapy itself has to take place through our partner there in Cancun, Galenia. But we've been sending our people down there for about 7 years now. And our team of doctors there at the hospital has seen essentially everything. Probably have as much experience doing stem cell therapy as about any other physician team you'd find anywhere in the world. And again, a differentiating property about Celltex is our ability to culture those cells into high doses, hundreds of millions of stem cells. So typically different from what you would see in a same-day procedure where they're isolating fat tissue or bone marrow and then isolating the stem cells from there and putting it back in an injection. Depends on how much tissue is taken out to start with, but with Celltex, we're able to start with a very small number and then culture as many cells as needed in the hundreds of millions. And that high-dose stem cell therapy is really what is needed to tackle a majority of chronic diseases and serious issues. We fully acknowledge that physicians who are doing things the right way, like Dr. G is, have a great place for stem cell therapy in the areas of mostly sports medicine, which is where Dr. G practices. Some of those, minor osteoarthritic issues, soft tissue injuries, stem cells, as Dr. G is doing, may be very well suited to tackle those issues. Whereas when you get into some of the more severe systemic, autoimmune, neurological, and other disease categories, a higher dose of stem cells is what's going to be needed to tackle those issues. So what we're able to do is we're able to match with different routes of administration or different modalities of therapy, match these with disease categories. So you'll see here the intravenous route is kind of the common thread here when it comes to the type of therapies we offer. That is kind of the foundation of what we do. That is a systemic administration and enables stem cells to do many things in the body. And certainly we can address those things more in the Q&A. But I just wanted to display some of these here on screen as far as some of the tools we have in our toolbox, so to speak. And you'll also notice down there at the bottom left of your screen, the wellness category. This is somewhat of a new notion, just as stem cell banking is. When we first started, we had people who were basically needing some emergent need for stem cell therapy here and now, whereas we're trending in the direction of people banking their stem cells proactively, as well as receiving stem cells therapeutically proactively for general wellness, anti-aging, preventive purposes. This is kind of a new and emerging aspect of what we're doing with stem cell therapy. So I'd like to conclude with a brief video here. Again, I encourage everybody to continue submitting your questions. Once this video concludes, I'll just have a couple more comments and then Dr. G and I will jump back on screen here for the Q&A section. But this is just a little behind the scenes look at our process and what we're doing in the lab.
At Celltex Therapeutics, the well-being of our clients is at the forefront of everything we do. From the moment fat is extracted until the moment our clients receive therapy in Mexico, their cells are handled with care, processed with precision, and stored securely. Let us show you how. First, a client must be determined eligible for cell banking. This is accomplished by a simple blood screen for certain communicable diseases. After the client is verified as eligible, a qualified physician extracts 10 to 20 cc's of the client's fat, which is then sent to our CGMP-compliant laboratory. The fat is received by our quality control department, where it is properly documented. A series of tests is carefully conducted by QC to assess the fat's eligibility to enter the clean room. A small portion of the sample is used in the testing process. Proper procedures are always followed to ensure that both the testing environment and the samples are free of contamination. At every step of our process, the sterility of the client's sample is of utmost importance, and we take extra care to ensure that it is not compromised. We conduct a series of tests to detect the presence of any contaminants, such as bacteria, fungi, and mycoplasma. The sample is then transferred to our cell manufacturing clean room for processing. First, by centrifugation, the excess blood is separated from the fat and discarded. An enzyme is then added to digest the fat. Then what remains is a collection of cells known as the stromal vascular fraction, which contains the mesenchymal stem cells, or MSCs, needed for therapy. This fraction is then further separated to obtain the pure MSCs. Once the MSCs have been isolated, they are maintained on a daily basis and routinely observed to make sure they are healthy and free of contamination. As the MSCs multiply in culture, cell counts are performed. Cells are frozen at every stage and stored in liquid nitrogen. When cells are banked, they are frozen in a control rate freezer. The cells are again tested for quality control for mycoplasma, bacteria, and fungi to ensure they are free of any contaminants. This verifies the sterility of the cells and confirms that they will be ready when the client needs them. The cells are banked in a liquid nitrogen cryotank. At extreme cold temperatures, MSCs can be stored for decades with virtually no loss of quality. When cells are needed for therapy, the vials are removed from the bank and thawed, so they may be freshly cultured. The MSCs are allowed to expand for 13 days. Cells are removed from their culture environment and washed several times to remove their growth medium. The cell suspension is then centrifuged to separate the MSCs from the enzyme, and a series of washes with various buffers is performed to eliminate all media residues. The MSCs are counted before being suspended in sterile saline and packaged in syringes. This is the final product that is administered to clients in Mexico. A representative sample of the final product is submitted to quality control, where multiple tests are once again performed. Sterility, endotoxin, and mycoplasma tests are conducted on the final product to ensure it is free of any contaminants. Cell concentration, appearance, and viability are also checked by QC, and the final product is sent to Quality Assurance. Quality Assurance reviews the product as well as documentation and performs final verification to ensure that every step was executed perfectly. Once this has been confirmed, QA releases the final product. The final product is then packaged in a validated temperature-controlled box for transport to Mexico. A temperature logging device is placed in the box to verify that the MSCs are maintained at the correct temperature during transit. Once the shipment arrives in Mexico, the logger's data is reviewed to ensure that the specific conditions were maintained during the entire journey. Every step of the way, Celltex is ensuring the quality and safety of our clients' stem cells. It is our mission that each of our clients experience maintained during the entire journey. Every step of the way, Celltex is ensuring the quality and safety of our clients' stem cells. It is our mission that each of our clients experience the healing power of their own body for years to come.
So we have a highly technical process in our lab, and for anybody in the Houston area or visiting Houston, myself or another member of our team would be happy to show it to you in person. So very high quality work in our stem cell banking, culturing, and therapy processes. So hopefully that gives you a little bit better idea of what we do from A to Z when working with your stem cells. So I'll wrap up here, and then Dr. G will get back on screen here with me, and we'll go through some questions. But just for taking time out of your day, I did want to offer a discounted rate on our stem cell banking for Dr. G's patients and everybody here in attendance. And that would be a rate of $3,250. That is a 50% discount off the regular price of $6,500. And then also wanted to provide you with an email address if you have any questions that are specific to Celltex and what we're doing with stem cell banking and therapy. You can email us at that address there at the bottom of the screen, webinar@celltexbank.com. So we will begin the Q&A. Dr. G, if you'd like to jump back on here. There we go. Can you see the questions on your end there in the Q&A?
Oh, yes. Yes, I have them.
So I'll just address this first one here because I know I didn't get to spend too much time on why our treatments are done outside of the US, and I'll explain kind of on Celltex end, and maybe Dr. G, you can explain on your end. Because at Celltex, we culture the cells. Once those cells have been cultured, and we're not talking a same-day procedure, we're talking about a culturing process that takes place over several weeks before the cells are put back into the body. The FDA views that as a biological drug, whereas they regulate different types of stem cell therapies, the same-day procedures, a little bit differently, or they classify them differently. So we are categorized under a biological drug, and therefore would need formal FDA approval to be able to do the therapy here in the US. So while we work in parallel, on a parallel track and working towards FDA approval, we're making certainly significant headway in that area. We did want to establish our partnership with Hospital Galenia in Cancun, which we did about 7 years ago, so that people had an avenue to receive stem cell therapy at that time, because we had a base at that time of about 250, 300 people, and they were seeing some significant benefits. So we wanted to have an avenue to continue down that road while also beginning the work on FDA approval. Dr. G, did you have any other comments about that as far as kind of stem cell therapy as you're doing it there in your office?
Yes, so obviously our process is same day, same sitting, and then certainly we harvest a sample for Celltex, so patients can, likely at the same time choose to bank some of their cells for future use. But I think a lot of it comes down to the condition that is being treated, and whether that can be managed with a smaller dose of stem cells, but they're fresh, they're obviously viable, viability rate is high. But again, I think it's more about matching the condition, and both organizations are working very hard to see if we can do the injection part here in the United States also, because clearly that could be a limiting step.
Okay, and what are your thoughts on stem cell therapy for MS? Do you have any comments on that, Dr. G?
I mean, most of my experience is obviously limited to sports medicine. I don't directly treat MS, and I think the challenging part there, which is where Celltex comes into place, is that these conditions may require a large number of cells, may require repeated treatments to get some benefit. So clearly the potential is there, but I think a lot more needs to be understood of how the stem cells can help.
One question here about Celltex, whether or not we use bone marrow. No, we actually only work with adipose-derived stem cells at Celltex.
The yield out of fat is clearly, 1 in 500 cells in fat is a stem cell, and 1 in 10,000 cells in bone marrow is a stem cell. So the yield from fat, certainly in terms of getting MSCs, is high, and I think that's why it's more. And certainly a larger amount can also be harvested if needed.
Here's a question, Dr. G. Are there stem cells without MSCs, or do all stem cells contain MSCs? I think there may be a good
Yes.
chance to clarify that.
Yes, there are certain other cells also besides MSCs. Now, we have to realize, what does MSCs really stand for? It's mesenchymal stem cells, and mesenchyme is the layer that is involved in forming a lot of the organs. When we are in the embryonic stage, the mesenchymal layer is from where the cells differentiate into a lot of what we are seeing. And the most important quality of MSCs is their anti-inflammatory benefit. And as you know, that each one of the conditions that we are encountering does have an inflammatory component to it. So I think that's where the application of MSCs is a little bit more broad-based. But certainly, if we were to say there's research going on right now producing cells that can release insulin, so for juvenile diabetic patients where, their body cannot produce insulin, there are cells that are being right now worked on in the laboratory process that will then, when implanted into the patient's body, function as a second pancreas and start producing insulin. So clearly those cells are more evolved than just being pure MSCs.
Another question here, Dr. G. There's a question that's regarding the multipotency of adipose-derived stem cells and their whether or not they are predisposed to differentiate into adipocytes versus chondrocytes or neurons or other types of cells in the body. Do you have any comment on the multipotency of adipose-derived MSCs?
Absolutely. When we're talking about MSCs, the multipotency is because of the MSC. The host tissue is fat here only in the discussion because it's easy to harvest it. Your liver is full of MSCs too, but if given a choice, would you want me to remove half of your liver to get your MSCs, or would you want them coming from the fat? So when we get to the fundamentals of the stem cell and its function, I don't think it's so much important as to the source. The source right now is the sources that we can easily collect. I mean, I was at a recent ortho conference and there was an excellent presentation of using the bursa around the shoulder joint, which is also full of MSCs. The bursal tissue, these are linings which are around the joint, was MSCs, and there the surgeon was actually using that tissue as a source of MSCs for treating that shoulder. So there's mirrored organs that we have. For larger application, currently we go to sources which we know we can collect enough tissue and not leave any harm or cause any harm to the body. Because you will regrow. I mean, I often joke and tell the amount of fat we're removing for Celltex is just, one trip to in and out, and you will have that fat back in your body. The bone marrow that we are harvesting, another a week, 10 days, and that bone marrow is back in your body. So.
Here's another question here about, actually part of the same question, and it's talking about umbilical cord cells, and the viewer here is suggesting that basically every lab that has umbilical cord cells has to be checked by a third-party, highly regulated FDA lab. My comment on that, and you can weigh in here too, Dr. G, is that I don't think you or I would necessarily advocate against research being done with umbilical cord cells or other cell types. The problem is that the physicians in the clinics that are utilizing these types of stem cells are not of the same caliber that you would find at UCLA or Harvard or Mayo Clinic or some other highly reputable institution doing research. The umbilical cord cells, what you would find in those highly controlled research studies, is not likely to be the same as what you would find at any physician who's using or supposedly using these types of stem cells at their clinic here and now.
And it's unfortunate sometimes because of few bad apples, the entire industry kind of gets labeled. So we'll stay away from making generalized assumptions. But here's my take on it. Umbilical cord banking just for the kid that industry has been going on for almost 20, 25 years. And there's so little published data and evidence on what those umbilical cord cells, even for your child, had any application. I often get calls from patients or parents saying, hey, I stored my kids' umbilical cord cells. I'm hearing so much about stem cells. It's been 12 years. I've been paying $100 a month rental fee. The cells are somewhere stored in a freezer. How long should I hold on to them? Right? So that cord banking industry has not even served their own clients with funding research or coming up with treatments, right? Now you're talking about using somebody else's umbilical cord cells in your body. Now we're getting into a territory where there's no more autologous. Now you're using a foreign system, a foreign cell. So obviously that has to be very, very strictly regulated. And it's extremely important to know everything from the source of those stem cells, how many stem cells are actually there. I mean, I had a slide I didn't get to expand on a cross-section of an umbilical cord, and you can see that the cellular content there is very less. But it also depends upon which company is harvesting. I mean, umbilical cord is a long structure. How much of umbilical cord was used as a source to get the cells? So how many cells are there? How many of them are alive? And what kind of reaction they will cause once they get into your body? I mean, these are fair questions that need to be answered. And hopefully they will one day, but we have to get there. So that is my take when it comes down to foreign sources of cells, you know.
And what, another question here, gentleman, he's 75 years old, and he's interested in treatment for osteoarthritis. So what comments do you have, Dr. G, about the age of one's stem cells and being able to work with one's own stem cells when they may be 75 years old and you know, not 40 or younger?
So that's an interesting question, and it's often raised because I think one of the prime ways people market baby cells is by telling patients that your own cells might be too old. While, you know, the statement on its face is correct that your stem cells are as old as you are, but the efficacy of your stem cells does not decline with age. However, there are certain factors that influence the function of your stem cells, and that is how healthy you are otherwise, you know. So it's a very individualized based question. You know, I've treated a 94-year-old who was a dancer all his life and had hip pain, was obviously avoiding any hip surgery, and wanted to be pain-free and be slightly active. And we used his own cells because he had taken good care of his body in terms of his diet, body weight, and exercise. So that, I think, is a more important thing that unfortunately nobody likes to talk about, is that your cells are healthy or likely to be more healthier if you have a healthy body. At the same time, yes, with age, and that's where the work Celltex is doing is important. If you require multiple treatments or your condition is so advanced, you know, that we know that you will be requiring multiple treatments, then it is better that you have your cells banked and multiplied so that they are available to you for as much treatment, you know, that's needed. And also, I think there was a second part to that question. Yes, even Celltex obviously does a job of counting cells, but we also, in the same day, same sitting treatment, every sample where before it's injected to you, there is a cell count and viability analysis done as part of our quality control to make sure that you're getting what dose you're getting and how many of those cells were alive. That's very, very important. And I'm glad somebody asked that question, because those are the questions you need to ask when you're seeking stem cell treatment, you know.
And again, something that underscores the difference between what you're doing, underscores similarity with what you're doing, Dr. G, and what we're doing at Celltex, and the need for those lab controls, quality control, quality assurance. You know, we showed the video of what we're doing at Celltex, and you know, that's an FDA registered lab. But for those who are doing in the same day arena as you're doing, Dr. G, they're very few and far between, the physicians that are doing that level as you're doing with cell counts, viability counts. I mean, it's basically a misstep most of the time. So I would certainly agree that everyone is encouraged to explore their options, and it's important that you ask these key questions of the process to ensure that you're getting a high quality product. Another one here, Dr. G, about the strength or the relative strength of bone marrow derived cells versus adipose derived cells.
So yes, cell for cell comparison, they are both equally strong. However, as I mentioned, fat derived stem cells from say 20 or 30 cc. I mean, Celltex obviously is capable of multiplying them, but even in a same day, same sitting procedure, 100, 200 cc of fat is likely to yield more cells, more stem cells than say 30, 40, 50 cc of bone marrow that is aspirated. So they are, and a lot of time I use both, depending upon the condition we're treating, because they can be complementary also. Bone marrow sometimes gives us good amount of growth factors and other things that can be used for regeneration process. So it's not just the stem cells, but also some of the other regenerative factors that we can get in the same day, same sitting procedure. Similarly, sometimes using PRP, which is platelet-rich plasma from the blood, that can also help. It's not stem cell therapy, but it can help the regenerative process. And so everything, I think, has to be customized and tailored to the individual patients, what their needs are, and what we think would give them a fair shot at seeing some good results.
Okay. I think that may be a good place to wrap up, unless there's any other questions you'd like to address, Dr. G, or any other comments, closing comments you'd like to make?
There is, at one of the webinars previously, there was a question about insurance companies, trying to cover these treatments. And trust me, both Paul and I would agree on one thing, that we can't wait for that day, because, a lot of people think, wow, I'm paying for stem cell therapy. Both at Celltex and at our clinic, literally every single penny goes back into your body in terms of making sure you're getting the right treatment. So the insurance coverage will certainly help us if we were interested in making money, because until then, we have structured our pricing in such a way that every penny goes back into your body in terms of taking care of your treatment. It's important to know that there was some question, I can't place it, about peer-reviewed research, and it's starting to emerge. The problem with peer-reviewed research has been that there is no such standardized protocols, and some of those are evolving as we go along. So, but there has been a very strong article on fat stem cells published recently in the American Journal of Sports Medicine. And if anybody is interested, you can email me and my office will be happy to send you that articles. There are obviously, as Paul mentioned, numerous clinical trials which are going on. But in terms of peer-reviewed publications, yes, there are few out there. But this one in particular was a very well-designed study, very well done, and we'll be happy to share with anybody who's interested in reading the article. You guys can obviously find me on thegoswamiclinic.com or just email Dr. G at thegoswamiclinic.com.
Perfect. And anybody who has a question about Celltex or stem cell banking, you can feel free to email us at webinar@celltexbank.com.
Thank you.
All right. Thank you, everybody, for joining us. Thank you, Dr. G.
Right. Stay safe, everyone.
Take care.